Hi everyone and welcome back to another episode of GP Notebook TV. Lisa Devine is my name and I'm a GP in Wicklow in the Republic of Ireland. And today we're going to have a look at the relationship between irregular sleep and risk of type 2 diabetes. Now, I think we all know that a good night's sleep is worth its weight in gold, and I think most of us feel the negative effects of a deficit of this essential fuel. Sleep is becoming a topic of much deeper interest in the world of medicine. Its role in different conditions is being studied more carefully. I was fascinated to see this recent journal article published this year in the journal Diabetes Care, and the title of the journal was Association between accelerometer-measured irregular sleep duration and type 2 diabetes risk, a prospective cohort study in the UK Biobank. The basis for this is that we already know that sleep duration, sleep quality and other sleep disturbances have been linked to diabetes risk in prior studies. Emerging evidence also suggests that sleep irregularity or variability, which characterises daily variations in the sleep duration or timing, may be a novel risk factor for metabolic health, and that's independent of sleep quantity and quality. The author's objective in this study was to evaluate the association between irregular sleep duration and incident diabetes in a UK population over 7 years of follow-up. The group they studied was large and consisted of just over 84,000 people from the UK Biobank. Now, for anybody who doesn't know, the UK Biobank is an ongoing, large, community-based prospective cohort study. As of July 2023, the UK Biobank involves just over 500,000 participants who were aged between 40 and 69 years when they were enrolled in the study between 2006 and 2010. They were recruited from a pool of 9.2 million people registered with the National Health Service in the UK, and at enrolment, participants provided e-consent and attended a baseline visit which included a touchscreen questionnaire, a computer-assisted interview about socio-demographic information, family history, psychosocial factors and lifestyle, and also included physical measurements and blood sample collection. The information obtained was detailed and genotyping was performed at baseline for the entire cohort on their blood samples. So the subsample of the UK Biobank participants was invited to participate in the accelerometer study and just over 84,000 agreed. This group had a mean age of 62 years and were free of diabetes at the time of providing their data. The accelerometer data was collected between 2013 and 2015, and participants wore a waterproof triaxial accelerometer on their dominant wrist for 7 days, and the authors measured their sleep regularity. They were also able to look at whether there was a relationship between particular genotypes that carried a higher risk of diabetes, sleep irregularity, and risk of diabetes. So what did they find? Well, the authors found that irregular sleep duration was non-linearly associated with a higher risk of diabetes. After accounting for comorbidities and adiposity, which are also associated with an increased risk of developing diabetes, the association did weaken. But it remained apparent when they compared participants with sleep duration irregularity of more than 1 hour versus less than 1 hour. Interestingly, they found that the association was stronger among individuals with a lower genetic risk for diabetes. Approximately 29% of the participants had sleep irregularity of more than 1 hour during the week. Participants with sleep irregularity tended to be younger and more likely to be female, more likely to be shift workers or current smokers. They were more likely to report a definite evening chronotype, have a higher deprivation index, a higher BMI and a shorter mean sleep duration, and they were less likely to be Caucasian. In their discussion, the authors note that sleep irregularity may give rise to diabetes through disrupting the circadian rhythms in metabolic regulation and daily patterns of lifestyle behaviours. The circadian timing system coordinates various metabolic functions, including insulin secretion and glucose metabolism via alignment with external cues such as light exposure and meal timing. When sleep duration is irregular, these cues are likely to be irregular too, leading to unstable circadian harmony within the body. This disharmony could lead to metabolic dysfunction and insulin resistance. The article also states that irregular sleep duration is associated with other metabolically unhealthy sleep traits, such as short or long sleep duration, poor sleep quality, and the evening chronotype. These traits have been shown to be associated with worse glucose metabolism and an increased diabetes risk. The authors also suggest that this is an area of growing knowledge and encourage further research to understand the underlying mechanisms linking irregular sleep duration with diabetes risk. So, how can we use this information in our everyday consultations? The authors describe sleep irregularity as a potentially modifiable risk factor. I think it is useful to be able to give our patients more tools to maximise their diabetes control through lifestyle interventions or moderate their diabetes risk. For some patients, information may be positive and empowering. However, this may not be within every patient's power to modify, especially those who rely on shift work for their wage or those who have young children at home who may not have read the journal. It is, however, a fascinating read and adds to our ever-increasing understanding of how lifestyle factors interact with chronic disease. I hope you've enjoyed this GP Notebook TV short video, and I look forward to making more videos for you soon.